More than 400 million people worldwide do not have access to basic healthcare services. Improving access to health for the most vulnerable is one of the main goals of Swiss Red Cross health programs. To reach this goal, SRC health projects contribute to better health service delivery while at the same time informing people about health issues and the right to be healthy. However, do people continue to access health services after SRC support has been phased out? To find out what really happens, we went on a journey seeking out the communities we worked with in the past. The first step towards better health is to understand your potential health problem and then have the desire to do something about it. The people we worked with told us that community groups and individual residents that act as local health champions remain good motivators, who keep educating families on health issues and advise them on where to seek help. In the Nepali villages that worked with the Swiss Red Cross, people have changed their traditional beliefs on maternity and childbirth. Today, women prefer to deliver their babies in the local health centers rather than at home. Now you know that you need to seek medical help. But do you trust your health system, and will you go there? Our experience showed us that health centers, where health staff are from the local community and where they have been trained and retained for a longer time, are highly frequented by patients. They speak the same language and they know the local customs and the people well. In Ghana, many staff trained through the SRC eye care program remain in post and ensure that eye care equipment provided by the Swiss Red Cross is maintained and continues to be used over a long time. Trust will drive you to visit the health center. But can you get there and find the care you need? Getting to health centers after SRC support is phased out remains a challenge for many people who cannot afford transport costs. Also, many health facilities face a shortage of supplies and equipment due to financial and logistic constraints. In Cambodia, capacity building, together with the introduction of a reward and penalty system for health service staff on their performance, has greatly improved the quality of care. For the rural poor, the good quality care makes the cost of travel to health centers worth it. You've found the way to reach the nearest health facility, and the care provided there is of good quality. But can you afford it? Will you be able to use it in the future? Establishing insurance schemes and community funds is a good solution to support the most vulnerable people in accessing healthcare. In Laos, for example, health equity funds prevent many poor families from massive healthcare bills. The funds cover not only medical treatment, but food, transport, and even funeral costs. Once the population uses healthcare services regularly, how do you maintain the demand for and the supply of quality healthcare? Focusing on the interaction between the people and the healthcare system empowers communities to voice their needs and provide feedback to the health system. That makes sure they provide the most appropriate service. In Bolivia, the communities are actively engaged in the performance and expansion of health services. They update basic family health records and deliver food supplements to malnourished children. At the same time, they engage in a dialogue with the municipality to fund new health priorities. Looking back at our journey, the study has enlightened us about our work and its impact. Good work and approaches used by the Swiss Red Cross have led to a continuous increase in the use of health services over the years. Only in the very remote places has people's access to health faded, because these areas no longer receive the necessary attention and resources. With the knowledge we have gained, we want to invest more in partnerships and policy dialogue with the government and other health actors. We want to explore new business models that sustain themselves when we step back. The road to improved access to health remains stony and long. If we can anticipate the potential barriers, it will make reaching our destination easier, in maximizing health and well-being for the most vulnerable among us.